Hi everyone. Thank you for attending the final OEH seminar of 2017. Today our guest speaker is Abigail Overduin. Abigail is a Canadian certified professional ergonomist. She was recently president of the Association of Canadian Ergonomists. Abigail has worked as the ergonomics advisor at UBC since 2011. Prior to working in the field of ergonomics, Abigail worked as a kinesiologist in occupational rehabilitation settings, conducting functioning capacity evaluations and permanent impairment assessments. Abigail has testified as an expert witness in the Supreme Court of British Columbia. In her spare time, Abigail mountain bikes and skis and recently started volunteering as a ski instructor for the Vancouver Adaptive Ski Society. So let's put our hands together and welcome Abigail.
Okay, thank you. Can everyone hear me? Okay. So I'm the ergonomics advisor at UBC, and today's presentation is about ergonomics at UBC, some case studies, and just some background about what happens at UBC in the ergonomics program. And so I want to go over the ergonomics program, and also just, this is kind of interwoven in the case studies, but as well, I'll just briefly go over like, an ergonomics program requires a systems approach to be really effective. We need to look at data. We need to go out on the shop floor or out to the environment to see the work that is actually being done and what's actually happening, because sometimes the data doesn't tell you everything. And we need to involve management and frontline. And then here's some of the case studies that I'm going to go through. We'll see how we do for time, if we get to all of them or not. So just briefly, UBC, the ergonomics program is quite broad. So we are looking primarily at musculoskeletal injury prevention for staff and faculty, doing ergonomic hazard and risk assessments, involved with return to work and job coaching, job demands analysis, looking at the physical demands in an environment, alternative duty lists, looking at our stats, involved with accident incident investigations around ergonomics, design recommendations. So this is a really important piece, because if we leave all of our ergonomics to the time when people are having injuries, it's harder to make changes. So it's really important that we get involved early, and then ergo shop talks, ergo training. And for me, working at UBC it's a really good environment because it is so broad. So we have almost all the industries that you can imagine take place at UBC. We have offices, labs, animal care, dentistry, mechanical shops, aquatic. So there's no end to the types of things that I could look at or the types of environment that I could be working in. Okay, so for those of you who have taken the ergonomics class, I'm sure you're aware of this, that there are WCB requirements around ergonomics. And it does place a legal responsibility on the employer to identify factors that may expose workers to a risk of MSI, stands for musculoskeletal injury, so musculoskeletal injury in the environment, and then to implement appropriate controls. So this program, it's not as clearly defined as maybe some other regulations where you have very clear numbers, this must be below this to be safe. This is more of a process. You need to be looking at where are your risks. Have you had injuries? Do you have reports of complaints? Do you have areas that are bottlenecking and becoming problems? Do you have low or high error rates or low productivity? All of those things might point to an ergonomic concern. And the thing that I have found really interesting in working in an environment versus being in school is getting good data. Because if we were to look at our injury data, for instance, we might have so many people in an X job are injured. But is a job title really descriptive of all the duties that people do? Not really, especially here. We can have people grouped in a job title that's related to pay, salary, and pay grade, but they can be assigned to very different duties. And if we had to ask supervisors or managers, when you're filling out accident reports, you have to put the job task. And they describe it, but I'm talking about how are we going to easily search our data. It would be nice if we had consistent titles for job tasks, but we don't have that. And a lot of times people are trying to rush through these sort of injury reports, so we don't necessarily have as good of data in the injury reports as we might like. So it's definitely something that I've noticed. Getting good data is more challenging than you might think. And the data that you think you need today, in 5 years' time, that data might be different. So it's I don't know what to say you can do about it differently, but it's just something to be aware of. And then the other thing is often companies they operate ergonomics kind of at arm's length. So, oh yeah, we have a process, we have that issue solved. If somebody makes a complaint, we just contract it out. And that's better than not doing anything when somebody complains, but it's not really going to give you a good systems approach. You're not going to get as good of results because you're just individually fixing this problem, you're individually fixing that problem. There's not necessarily good crossover in how everything is working together. So a good ergonomics program really needs to be embedded in your safety or in your HR so that systems are working together and there's better connection. And I wanted to briefly talk about early intervention because sometimes when people talk about ergonomics, they are thinking of early intervention. So early intervention would be when somebody makes a complaint, they're experiencing pain, we hire an ergonomist to go look at that person. The goal from the company's perspective for the ergonomist is really to just provide some job coaching. Maybe teach the person how to lift safely, maybe look at some administrative controls such as introducing task rotation or telling the person, well, make sure you get help before lifting. And those things, they might be helpful in that situation and they might be all that can be done at that point in time, given that all of your infrastructure is in place. But how much difference is it really going to make on your risk level, right? If we're relying on people to always use safe lifting technique, like, yeah, people need to lift, be careful how they're lifting, but no one's going to lift perfectly all the time. And sometimes the shape of the box is too awkward. So even if they tried, they couldn't really use safe lifting technique. Sometimes the culture of a workplace, if I find that this is heavy and I want to ask for help, but nobody else asked for help, so I don't want to look like the fool who's got to go ask for help. So there's a lot of factors that will dictate how well those types of interventions really work. And so early intervention alone is not an ergonomics program. Okay, so with that said, I wanted to talk to you about some of our environments that we've been working with. So Campus Mail. Campus Mail is a really interesting one. When I started in 2011, and I did some assessments with them, and the primary concern was sorting through mail, so letter mail. That's what was taking up the bulk of people's time, and that is where people were experiencing injuries and some discomfort. And then when we look at our stats, now they have a small department, so one injury significantly impacts their injury rate, but you can see that they've had a pretty steep increase in their injury rate. And so we met with the department to talk about what are some things that might be driving this. So one thing is our campus is expanding. We have more staff. We also have a lot more student residences. So that's one thing, and we could get objective data about that. The second piece was people shop online a lot now. And people shop online to buy big things or heavy things a lot. And that's not something that we actually have really good data on because Canada Post ships the mail to UBC, but unless that mail needs to be scanned or it's tracked, we're not counting every piece that enters into Campus Mail. So we don't actually have a good number for exactly how many pieces are going through Campus Mail, nor do we have a weight for all of those items that are going through Campus Mail. So we're making some estimates, but this was a concern. We're having an increased injury rate. Initially, let's say I was called in because somebody had an injury, can you do some training with this person to help? And in looking at that, we said, well, wait a minute, you have an overall increased rate. We looked at, from the information we can get from the incident reports, what was contributing to it, and you can see that lifting was a big contributor, and the other one was navigating dollies. Between those two, that took up most of their injuries. So that gave us a good starting spot. It's also interesting to note that the ergonomic related injuries, and so from WCB perspective, they consider overexertion and repetitive strain as ergonomic injuries. Those types of injuries tended to result in more time loss than our other types of injuries. That was another interesting finding. So when I did a more detailed assessment in the area, what was really interesting to see is we get mail from Canada Post. Sorry, I just have to use the mouse to point. We get mail from Canada Post, and then we have to unload it. And so to unload, it comes in big monotainer bins. So to unload it, Staff have to reach in, lift out the items, decide which zone they're going to sort it into, and then put it into that cart. Or if the mail needs to be scanned, it's going to go into a different area. So it goes to a different cart, and then from that cart, it goes into a room, it's unloaded from that cart, scanned, reloaded back onto that cart, brought back to the floor before being loaded into the truck. As well with Canada Post, like if we have a heavy item, the Canada Post, when they send us the monotainer, that heavy item is going to be at the bottom. We can't put the heavy item on top of our light items, right? So it means that lots of things get handled multiple times because you lift out the light items to get to the heavy item, move the heavy item over, put the light items back on top. It's a lot of, items are handled a lot. So it goes from Canada Post having it, to us sorting it, to us putting it back into our trucks, and then delivering it across campus. So one item could be handled anywhere between 4 and 13 times in that process. Presumably if you had a really heavy item, that item might not be handled 13 times, but it's a lot of lifting and it's a lot of moving, and it doesn't seem the most efficient system. So here are some examples of what we found. And you can see in this one, so this is one of our containers that we have. How are you going to train someone to lift safely out of here? Right? The side comes down a bit, but it's still going to be awkward to reach across and get that box to the far end. And hopefully you haven't put a heavy box at the far end. As well, I should have shown you this picture first. This picture is the ramp. So at our facility, the trucks that they have currently do not have tailgates. Most of them do not have tailgates. So they have to put down this ramp, which weighs 50 pounds, and it's a risk of a pinch point when you actually drop the ramp down onto the ground. And then the letter mail, so in this picture here, that rack full of letter mail it needs to be wheeled on. That fit perfectly. They had that stuff designed because that was the bulk of their work in the years when they designed that. But I found it kind of amazing that they didn't have many situations where the racks went off the ramp, because that ramp's pretty narrow. You've got a bit of a bump to get it on. So they hadn't had that many injuries with that, but that was how they got letter mail on. And then they would bring the heavier items or the parcel items in this big blue bin, unload them individually, and then just sort them onto the ground in their truck. So I think when you look at it in these steps, I think it's fairly easy to see that there are a lot of concerns. And then here is the example of what their truck looks like, and it can be even busier and busier times. So every item you have the same issue. The heavy items need to be on the ground, you're sorting things on top, then you get to where you're going to unload it, and now we have to take the items off and we have to load them onto another dolly. And here's a good example. So this is what the process was. And then one time I was talking with one person who was having trouble, and I said, like, if you have heavy items, use a dolly to move it. Don't lift it. But because the way that they had traditionally used dollies was how this picture shows of the 4 wheels are out on the ground and it's flat. So in order to use a dolly, in her mind, she's got to lift this box from the floor onto that dolly. And for those of you who took the Ergo course, you might be aware, if you have good handles on your box and you're lifting from like just below your knee height, that's not nearly as hard as the times when you have no handles on your box and you've got to get your hands underneath the whole box. That 8 inches makes a big difference in how challenging that lift is. And most mail that comes does not come in boxes with handles. It's usually not with handles. And so it was a good example of when I went to go see what she was doing and saw how she had interpreted what I said. And what I had meant is to use a 2-wheel dolly and just tip the parcel onto the dolly so that you're never actually lifting it. Of course, in these pictures, you can see that wouldn't be possible, but in the new trucks that they're getting, they have tailgates, so they could do that. So some of the changes that we were able to implement was we got different carts. We went to Canada Post, saw what Canada Post was doing, did a large tour of their facilities, and those carts that you see in the picture, they're narrower, so you don't have as far of a reach. It's not to say things are perfect, you're still lifting out of a cart. It would be nice if it was spring-loaded and you got everything to waist height, and it would be nice if all your boxes were neat and a consistent size and you could fit everything neatly, but that's not the reality of what they're dealing with. So these carts in the picture here, they actually fit in their current trucks, so even the trucks that didn't have tailgates, so that if both places that they were loading and unloading had a loading bay or loading dock, they could use these carts. As well, we are going to go to trucks with tailgates. So to accommodate like the changes that have happened, right? Students order a lot of stuff, but as well staff and faculty are ordering things online. They aren't home when items are delivered, so they're choosing to have items delivered to campus mail. And that ends up with them handling a lot of stuff. So some other changes were swapping carts at Xerox. That just was, at Xerox what was happening is Xerox would load boxes of paper onto a cart. Campus mail would come, take them off the Xerox cart, load them onto their cart, and then take them. So instead of doing that, we're just swapping carts. They've improved their scanning system so they don't have to handle boxes so much while they are doing the scan. We've increased the number of runs to divvy out the workload a bit, making sure hand trucks and dollies are available. They have safe lifting training, posters. Changes to parking tickets. This was actually a big thing that came up while I was doing my assessment. Was UBC campus, for anyone who drives on campus, I'm sure you've come across, it's challenging to get parking. Particularly if you want to get parking close to a building when you're trying to pull these carts off. And so a lot of the staff, at some point in time, they had thought that they were personally going to have to pay for the tickets that they received. So they were able to make some changes to reduce some of the stress associated with that, as well trying to do a better job of posting the road closures. Again, all the construction that goes on here on campus, it's hard to keep up with the changes, and then if you need to access a certain building from a certain side to get to the loading dock, when a road's suddenly closed, that can really throw off your day. So it made improvements to that. We're trying to get improved access to loading docks themselves. Not all buildings have loading docks, and not all loading docks are easily accessible, or nor is their parking always well monitored, so sometimes there could be a truck there all day, meaning that campus mail couldn't get in. And we're also trying to work with Canada Post to do a pre-sort, because UBC is like its own city, and Canada Post just sorts to UBC. They don't pre-sort according to any of the different postal codes at UBC, which means that we're having to do all of that work. Whereas our facility here, or the amount of parcels and letter mail that we deal with here, is probably similar to what Canada Post deals with in some of their smaller communities. So that's an ongoing thing. If we could get them to do the pre-sort, then that would reduce the amount of handling that our staff are having to do. Any questions about the campus mail? Okay, I will go on to the next one. So childcare. Childcare is an environment that I really enjoyed working with. I find the staff, they're amazing. They really care about their jobs. They're very interested in working with children. But the environment is challenging. You have small people, you have adults that are tall, and unlike if you're a parent, your children eventually grow up. Whereas these people, hopefully, are working with children of a young age potentially for their entire career. So that's harder on the body. So in this process, we teamed up with WorkSafeBC to create these Ergo Hazard for Childcare poster or resource sheets. In that process, and working with the ergonomist at WorkSafeBC, we also met with an architect. And he was really amazing. For one, he has worked his entire career as an architect working with child care centers, which I think is probably unusual. And he was himself like so interested in how kids interact with the space, how the space is used, how it impacts everyone. He really thought about all of these things, which again doesn't happen in a lot of environments. A lot of times it's about what's going to look good in a magazine, what's going to bring in donor dollars. So he would even think about things, if you look at this last picture here with the child, he would think about what's the height of the tap relative to the child's elbow height. Because if the tap's above the child's elbow, water's going to drip down their arms, it's going to drip down their arm onto the floor, and somebody's going to have to clean up the floor. So I thought that was amazing to have an architect who was thinking that much about function, because often that is what we need to do as ergonomics professionals, is to try and educate on the impact of how space is actually used. So some of the things that are done, and this first picture, this is in a childcare center that is multi-age. So it would have been a challenge to get things right for everyone. But looking at the depth of that sink, right? The kid can hardly reach the tap, so the height of the sink, the kid can hardly reach the tap. So trying to put those things at the right height and depth. Design is critical because it is much harder to make small changes in childcare. The second picture, this middle picture, just shows here are some options. Like if if these things are already built, it may not be possible to rip them out and change them. So can the staff members sit down? Is there a possibility of putting a chair in there so that at least they're sitting and not having to bend over and reach to help the child? And then at UBC, I think philosophies in raising children changes over time, but at UBC, like, there's a lot of emphasis put on they want to help the children become independent as soon as possible. And that is helpful because then the more independent the child is, the less physical stress there is on the staff member. And just in general, like allowing children to play on their own, and you want good lines of sight so that the staff member can see what's going on, but the staff member doesn't need to be the one entertaining and playing with the child at all points in time. Some other changes that we made, and some of these were small, but just looking at, sorry, remember to do this. Initially, when I came to UBC, they were hanging trikes on the ceiling. And these trikes, they probably weigh, I think the weight was 25 pounds, 26 pounds, but they're awkward because the weight is all at one end. And then when you hang them up above, the trike gets hung up on the things below. You can't get in close because, of course, you have the ground full of other things that you're storing there. So that was an easy change. We were able to bring in, like, don't hang up the trikes, keep them on the ground. In some facilities, they don't even put them in the shed. They're just keeping them out, and the children can get them when they need them. So some changes require that you need to have thought about this in the design phase. And some changes, sometimes there are things that you can do to reduce the risks even after the fact when you're not going to make major changes. So something else with childcare is helping children get ready to go outside. And again, like, if the children are at all of ages where they can be more independent and they teach kids tricks to get their muddy buddies on quickly on their own, but sometimes staff do need to help. And so you can see in this first picture, this bending and trying to hold the child up, and children are unpredictable, right? It's not even like the child's necessarily going to just stand there nicely and do what you say. They might suddenly see a toy that they want to get and try and run away, or they might try to stand up straight and they hit you in the face as you're doing that. So there's lots of potential risks in this situation. So allowing a place where the adult can sit down to be at the child's level. And speaking with the architect, some other things that we try and do is actually have a better ledge over here so that they can sit down there as well. And also, one of the things that he actually noticed was this original design where you have a separate cubby holes for the feet is more challenging for the cleaners because you can't just sweep along. So now we just make them all open rather than the individual cubbies. And as well, even thinking about what's the shoe depth. Because if we make the depth of that ground cubby all the way to the back wall, for one, people are going to reach in there and they might hit their heads. For two, it's just like more bending and reaching and things get lost in there. So we only make them as deep as the shoe size and then open so that it's easier to clean. And then trying to provide space for the adults to sit down so they can be at the child's level, and as well trying to get the children to be as independent as possible. And then lastly, just wanted to show, again, another simple change that people can make, because in childcare there is so much bending, and we can't reduce all the bending. We can't put children on, that we're going to put in ceiling lifts the way that we have done in healthcare. So trying to think of any ways that we can reduce the amount of bending that they need to do is helpful to them. Oh, actually, sorry, I forgot about this one. Cribs. Cribs are a big challenge because the Canadian government, originally there were cribs where the sides came down. The Canadian government has banned those. They're considered not safe. Yeah, they did that just recently. So that led to a big challenge. We had to get rid of all of those cribs, and we got standard cribs. And you can see in this picture, this individual Right now she's holding a teddy bear, but if she's holding a child, she can't even reach the bed of the crib with her feet on the ground. Right? So how is she going to get a child, or how is she going to lower a child without dropping the child down? So normally they do it when the children are awake, so the children can kind of be sitting up. But if the child was sleeping, it would be a real struggle for her to get it. And so this picture beside, this one has been approved. But if we did a risk assessment, it's still going to be high risk, because if you lower this by, is that 8 inches? If you lower this by 8 inches, she's still got to bend quite a bit to pick that child up. So these are the situations that you run into where you want to make it low risk. You want it to be like, this is safe. But how are we going to do it? We try not to use cribs too much. At UBC, we don't have to use them too much, but sometimes they are needed. And the second picture, this is as good as we can get. We thought about introducing like a step stool, but then now you have trip hazards while someone's holding a child. So it's a challenge. And then there is, on the WorkSafeBC site, there are, I think, about 9 of these resource sheets. So if any of you go into a business where you're dealing with childcare centers and you're worried about the ergonomics, we have a lot of information on that. So we'll leave that for your reference. All right, so office ergonomics. Have any of you worked or had any experience doing office ergonomic assessments? Okay, so just a couple of you. It's definitely, as I was explaining at the beginning, before I started my presentation, sorry, is that we have our WCB stats consistently. Overexertion is at least 30% of our injuries. It's the #1 for days lost every year, maybe except for 1 year when it was #2, but it is always in the top, followed by falls on the same level. Those two are very consistently our top 2 for frequency and total days lost and total cost. But most of the requests that I get, people who contact me, it's related to office ergonomics. So it's definitely been well out there in the media about ergonomics, and people think about offices, which is good. But it's not all that ergonomics is. As well, sometimes I will hear from managers like, if you do an assessment for this person, like everybody's going to want something now. And this is where you need your process up front, because you need to have at least decent standardized equipment. If you have an environment where people are working with, let's say this chair, I know the people online can't see, but this sort of chair as a task computer chair is not appropriate, right? It doesn't have very many adjustability pieces. The chances of it fitting someone just right and working with their workstation is pretty small. So if you have people who are working on this, and then let's say just this desk and nothing can be adjusted, it makes sense. If I do an assessment for you, the next person's going to ask for one, because probably everyone's in discomfort. So it is, and it's still something that we work on UBC, because UBC is very decentralized. Not everyone has the same equipment or the same access to quality of equipment, but that's a big piece. The other thing is, so we try and work with Properties Trust and Project Services to try and help get those things standardized. We do have an equipment loaner program. So ideally you would have a relatively good standard level of equipment. And then for those one-off situations where people are having real concerns or real issues, you'd have some loaner program, some loaner equipment that people could borrow and try and see what it feels like. And along with the loaner equipment, it's not, you shouldn't just randomly like, oh, you have pain with using your mouse, try this mouse. You have to know why you're trying a different mouse and why you think this mouse will work instead of that mouse. But to have at least a couple of pieces of equipment that people can trial if they're having issues. Providing training. So this is a really important piece, and it's also a challenging one to get through to everyone, but people need to have some training on how do they adjust their chair, right? Most people, you just sit down on the chair that you're given, and when you're young, you probably get away with that. Over the years, though, that will become a bigger challenge for you. And chairs seem very complicated. And I can understand why, especially because there are some chairs, sometimes you hit a lever and you feel like you're ejecting yourself from the chair. So people need some training on how to use the equipment that they have. We have started using, I call it online self-assessment. It's not 100% a self-assessment in that it is online. We would get people to go through, answer some questions about how well the chair fits them, what height their keyboard's at, and to include pictures of them at their workstation. And then, unlike a true self-assessment where you would just get spit out a score and told something to do, I do review those and then provide recommendations and or go do an assessment depending on what I see at that point in time. We have departmental office ergo reps. So those are people embedded in departments that have received a little bit more training so they can provide staff with guidance on how to make adjustments to their chairs. And then we do individual assessments. So before I go any further though, I wanted to ask, how many people have heard sitting is the new smoking? Okay, so that's very popular out there. But how many people feel that there's enough research that supports static standing is going to cure you? Right. But in the media, there's so much about sitting is the new smoking, and so then the assumption is, well, I need to stand at my desk, and I need to stand at my desk for 8 hours straight. And I don't think the research supports that. In fact, we've known in working with food services and cashiers that static standing in one spot, brings its own health risks, also increased risk of cardiovascular disease, back pain, varicose veins, poor circulation. So I think being sedentary has health risks, and sitting is a sedentary task, but static standing at your desk is not really much above static sitting. So that's the one thing that I try to bring up, because although I think there's lots of advantages to high adjustable desks, I think that they get oversold to people as this is going to be the cure that saves you. We do have some online resources about proper workstation setup for both a seated and standing position. And so because a lot of you guys you're sitting and doing office work a lot, I thought I'd just quickly go over a couple of things. And one is that you do need your feet supported, you do need to use your backrest, and you need your keyboard and mouse below your elbow. And monitor top line of text at eye level. So that's a challenge with all of you on laptops. Your keyboard and mouse can't be below your elbow, and your monitor top line of text at eye level. So for people who do a lot of laptop work, I would say get an external keyboard and mouse. I really think that today's world, everybody is trying to see so much on their screen. Laptop is a very small screen. And laptops are often heavy to carry around, so there's risks associated with moving there. But yeah, if it were me, like I don't work from home because I can't stand working off a laptop screen. I just work at my desk because I have a decent sized monitor. Having said that, there are people who've gone the other extreme, and I see people who have 2 36-inch Macs. How are you going to put that all in a good line of sight? It's impossible. Something's going to be too high, something's going to be too far left, something's going to be too far right. It's just, that's a challenge. So there are balances. For standing work, the same principles apply. So I wanted to bring this up because, again, I see so many people who say, well, sitting is the new smoking, I need to stand, so I've developed this contraption at my desk to help me stand. But then they're standing in really awkward postures. Sometimes they're standing and bending over. They somehow manage to raise their monitor up, but their keyboard's still down here. So they're kind of typing down here and looking up here. Or things aren't at all correct. So the same principles apply. It's not worth standing to stand in some sort of awkward posture. You need to be able to work in a neutral posture. This picture here, I thought I would bring this up because there's a lot of students in the room. And this is a cardboard box from Oristand. It's not height adjustable, so whether it works for you or doesn't will just depend on your height. But it is a very inexpensive option. So if you were somebody that was having a lot of trouble with sitting, you could try that. I bring this up because, so it'll be interesting to see exactly how WCB adjudicates each claim. But when they come, if somebody were to put in a repetitive strain injury in an office environment, they come and they do an assessment, and some of the things that they look at are risk positioning. And this will be interesting for me because as an employer, let's say if we decide that there's a risk and you need to wear steel-toed boots, you need to wear steel-toed boots. It's up to the employer to enforce that. That seems like a reasonable request. The employer should be able to enforce that. But how are you as an employer, how are you going to enforce people not doing this and people doing this, keeping their wrist straight? I don't know. I mean, we have to provide education, but it's definitely part of the challenges. So your wrist should be relatively neutral. And in this bottom picture, Control, so a lot of people hit the control button a lot. So think about what you do with your wrist every time you hit the control button. Because some people will tend to just crank their wrist to one side and some people actually move their hand. Cranking your wrist, as indicated in this picture, is going to be a lot higher risk than keeping it straight. Same with using the mouse. How's your hand positioning on the mouse? And then I wanted to bring up, we know that non-physical factors impact the risk of a physical injury, right? So what happens when people are under stress, they tense up, they may increase cortisol or sustained elevation rates of cortisol. So just being aware that we know that some factors and psychosocial factors, I think there's still lots of research being done on it, but some factors like autonomy, rewards and recognition, supervisor and coworker support have been shown to have a protective effect. So just being aware of that, and also for those of you at UBC, being aware that there are resources available both for staff and faculty and for students. So I think UBC has a pretty good network of resources. Definitely take advantage of them. And then thinking about things even like mental workload. So every time an email pops up, you have to look at the email, decide whether you're going to respond to it. So I think like, okay, that's an easy question. I'm going to respond. Start to respond, and I realize I have to look through 6 other emails to get to the answer to that one. And then, 15 minutes later, finally I'm done that email. Then I have to reorientate myself back to my work, and another email pops up. So it depends on a person's learning style. It depends on their job requirements. Sometimes it's what your job is. But I personally found that email pop-ups really I found I was getting distracted and not really getting my work done. Okay, and then lastly, I just wanted to touch base on dentistry. So we have a big dental clinic, which means that we have people who have to clean all of the instruments. And this one particular station, it was called GPI station, there was a nice table, stainless steel, but it had shelves underneath, which is good. One of the problems is they have not enough space for the amount of work they're doing. So that's always a challenge. How are you going to fit everything in that you need to have fit in? So they had shelves underneath. Well, that made the table awkward. The table was too low. For short people, it was actually okay for standing, but the table was generally too low for standing. You can see it resulted in a lot of bending. But then if you tried to sit, you couldn't pull in close. So you either ended up twisting or sitting further away and leaning forward to do your work. Reaching the shelves was a challenge. And then beside here, this picture's a little bit hard to see, but when things came out of the washer, all the instruments come out of washers, they put them in those little baskets, and then they get the instruments out of those baskets to when they're wrapping at the GPI station. So to get them out of the baskets, they've got to individually lift up each basket, see what instrument's actually in it, and then figure out which one they're going to get. So it's really slow process. It also was awkward because as you're trying to lift, they're not heavy, but as you're trying to lift one, you're holding up several, and so you end up often doing it with just your wrist. And the job in general involved a lot of finicky work, so there would be a pretty high risk there. So this had been an area that had been coming up repeatedly, and I don't have a picture of a solution, but we did change it, and we got a height adjustable table and made it so that there's no shelf so that people can pull in properly. So in doing that, though, I don't know if any of you would have attended. Jeff Wright did a presentation last year, and he talked about the ergonomics, I can't remember what he called it, but ergonomics task force team. So they were, basically his point was, we can't just have one ergonomist out here doing the work. We need to be involving the people, the frontline people. They need to be well invested in this process. So in doing this project, we did develop a task force. We had management on the task force, and we had frontline workers, so that we could look at okay, what are all of the concerns that come up? And also to acknowledge we have some constraints. There's limited space. We can't have the table come out too far because I need to push carts around it. Width-wise, we had one washer here and a new cart that held those baskets and another washer. So the width really couldn't change and the depth could not change much. So just being able to go through that process and making sure everyone understood what the limitations were, what we were trying to design, and then getting a height adjustable table. And I went there just the other day to have a look at it. I took some photos, but then as I was trying to put them into the presentation. I accidentally deleted them, so I couldn't put them in the presentation. But I would say like it's definitely been an improvement, but it was a good learning experience as well. So for example, we have the shelves attached to the table so that everything can come up and down. Well, when we asked for the depth of the table, they attached the shelves to the back. So that meant that they gave us the total depth that we asked for, but we basically lost at least 2 inches of actual workspace. And then the other thing, and I didn't think of it with them, and I didn't measure it to know what they did exactly, but in office environments, when you get a height adjustable desk and you say, I want 30 inches deep by 48 inches wide, not every vendor is going to give you 48 inches wide. They give you 46 inches wide. And they say that they do that because of pinch points. They don't want you to end up with a pinch point on either side, so you need a little bit of room. Like the first time I realized that, I felt like, why don't you just advertise that that's what you do? Because I measured the space to fit what I thought was going to be 48 inches, but you gave me 46 inches. So you learn these things as you go through the process of like what actually happens in manufacturing, what do you actually get in the end result isn't always what you thought you were going to get based on the drawings and based on the dimensions that you had given. But those are the things that come up and you learn as you go. I think, yeah, that was it for my presentation. So I don't know if there's any questions or anything that anyone wants to say. Mm-hmm.
To use an external monitor with your laptop?
No, that is exactly the ideal situation. Your laptop should be used just as a docking station.
Yeah.
From my experience, and I can imagine for sure with students, but even at UBC, we do have one department that works a lot off of laptops. I've been really struggling to try and get them to change that, but it's partly the portability, and they don't have a fixed office location. So they don't want to deal with moving things around, which I understand, but I think there's ways around. We could keep monitors in certain locations, but that's part of the education that I need to do with them. But yeah, a laptop, it's hard to get the keyboard and mouse at the right height and the monitor at the right height. You also get a lot of contact surface underneath your wrist. So that as a risk factor for carpal tunnel syndrome is contact pressure right here. Your median nerve is close to the surface.
Have you used the Microsoft Ergo keyboards that have the padded space there to rest your wrist on?
Yes. So they sell them as wrist rests, but they should be palm rests. So you need to rest your palm right here and not your wrist because your median nerve is close to the surface. You actually want nothing touching your wrist and rest your palm. Personally, I like that one. I wouldn't say that everyone needs to use it, but I do. I like the one that has a separate number pad so my mouse can be closer. That would be the one that I prefer. Yes.
Thank you so much, Abigail. I do have a question related to your work and how this is being processed by WorkSafeBC. So can you provide us with a little bit of insight as to the number of claims that you come across and how these are accepted or adjudicated for the examples that you went over?
Yeah, so I can say because we just looked at our stats, but we looked at them since 2010, and for accepted time loss since 2010, we had 870. So I think we average about 124 total claims per year. And then overexertion is about 30% of that, consistently around 30% of that each year. Repetitive strain injuries, very few. We've had 15 since 2010. But when a repetitive strain injury is accepted, so the average time loss for our overall claim is 32 days. But the median, I think, is only about 7. So the average really gets pulled up by the top 25% of claims, right? So the average overexertion claim is 37 days lost. The average repetitive strain injury, 110 days lost. Yeah. So when the repetitive strain injuries are being accepted, now I asked WCB, what is your acceptance rate or denial rate of a repetitive strain injury? Their answer, and I haven't dug with them enough, their answer was that was complicated. So eventually I didn't want to answer it. And then it's complicated from our perspective, and we could do a better job, but we We've recently gone to a new system of reporting, which is much better, so we'll be able to track things. But people will submit something as a repetitive strain injury. So in the last few years, we had 24 claims submitted as a repetitive strain injury. It doesn't mean that all of those or almost all of those were denied. Some of them may be accepted as another claim type. So that's like where we need to figure out the matching to figure out exactly what percentage are being denied. We do not have many people come forward and submit any WCB office ergonomic related claims. It's very rare. And UBC, we have good sick time, right? So it's hard to know, is there no issue, or is everyone getting their issues fixed, or are people just taking sick time and not reporting it as a WCB? And we have decent extended health, so people are going to physio and massage, et cetera. Yeah.
Sorry, we do have a question from our remote listeners. The question goes as follows. Have you followed up with injury analysis in the mail department?
Oh, well, they are, so the trucks, I just emailed them. I was like, have you gotten the trucks yet? We started the process with them in 2014, but things take time. And so in 2016, they said they were getting the approvals to order the trucks. And when I emailed them just the other week, they said, soon, we're getting the trucks soon. So they do not have the trucks yet. Yeah. So yeah, I don't think much has changed yet.
I'm letting the online audience here ask their question. They're still typing away.
Great presentation. It was really interesting. I was just wondering, for the dental tools, do you need to put all the tools into one box and stack them all? Like, I was thinking of like your silverware, you could separate out like all the different silverware. You could do the same thing with tools and just have a few of them stacked like that.
Yeah, they need to make sure that when they're being washed, they can be fully washed. And then they do go into cassettes, which would be kind of like what you're considering. So some things are in a cassette when it goes through the wash, and some things are hand pieces, and they are put through individually. And then they like to keep them in separate baskets because when they're going to sort, so they put together a tray, and the tray is for a dental dentist who's going to be doing X procedure. So they'll put X pieces of equipment in that tray. So it's easier for them because when they're going to make, let's say, a tray for pediatrics, they'll make like 6 trays for pediatrics at once. So it's easier for them if all the pediatric-related tools are together, which is why they keep them in separate Tupperwares. But it's a little bit overkill, but we ended up getting a different cart, so it's much easier for them to sort. I think what happened is not everything's washed at the same time, so they just pull it out, put it down, pull it out, put it down. So there is many places that process was not ideal. Yeah.
Thank you for your talk. I have 2 questions. First, who is in charge of providing funding or budgets to support the change? And second, if it's a UBC, if the provider is a UBC, is UBC often reluctant to provide such budget, given that it takes so long to implement a truck?
Yeah. So at UBC is very decentralized. So every department operates individually and has their own budget and needs to maintain their own equipment. Sometimes there is funding for exceptional circumstances, but for the most part it is the department's responsibility. And that's one of the reasons that in doing an ergonomics assessment, you saw the WCB kind of process at the front where it said consult with employees and the Joint Occupational Health and Safety Committee. And I think like WCB is saying that from the perspective, assuming that they're telling the employer that. But sometimes when ergonomics is consulted out, it does result in management not being involved enough. And then you can run into situations at the end where it's like, well, who's going to pay for this? So hopefully you're involving management. So the example with Campus Mail, it was an ongoing thing. We had a lot of discussions with them, and they also saw their business had changed. They were no longer doing primarily letter mail. So there were many things that had to be in place for that recommendation to be able to go through. If I had just said, hey, look, you've had 9 injuries, you're going to have to pay several $100,000 to get 5 new trucks, that probably wouldn't have happened. But it was in like building that relationship and looking at everything, and also looking at ergonomic related injuries. So the injuries that impact people or the way people are doing things often are related to your productivity and error rates. So when you have to lift an item 13 times, that's not very efficient. Right? So then they could see like, okay, yeah, this makes sense for us to change. But that's part of it. And it's a challenge because if a manager's here today and he knows he's not going to be here in 5 years, how motivated is he to take on this budget cost that he's not going to really see the benefits of, right? So that definitely becomes a challenge.
In the childcare setting, I was wondering, has anybody come up with a crib that has an elevator under the mattress to get the little kid up to where he's easier to pick out of the crib?
Well, in a crib setting, no, but I don't think that would be allowed because of, like, there's so many rules around cribs and the risk of children falling out or the risk of children, like, I'm actually surprised that flip down thing is allowed, but somehow that's allowed when anything else seems not to be allowed. But there are some lifts, although I think they are more for change tables, and I think they would be more often used probably if you had somebody who was a bit older, maybe with some mental, physical challenges, and then they were going to be really hard. So our change tables, for instance, our change tables are all around waist height, and the kids have stairs where the kids actually climb up. And that works fine, which I was surprised at when I first saw, but that works fine. So there are the electronic height adjustable change tables, but those would be used, I think, with like adults or adolescents who needed access to a change table. Yeah. But it's a good example of how things is not so straightforward, right? Like, it's like, oh, this is what we need. Well, you know, what are all the regulations in place? What's everything going to be impacted?
Okay, well, there are no more questions here. I would like to thank you very much. This was a fantastic presentation. It closes our first term for the OEH seminar series. Thank you very much, Abigail.
No problem. Thank you. I'd just like to say good luck on your rest of your semesters. And thank you to all of you who did Ergo projects. So there was an Ergo course, and several of you did projects with us for your ergonomics course. So thank you for your work, and I am looking forward to seeing the reports.